Hello, everyone. My name is Gemma Castellon, an FFP 597 student with Professor Cavatigan. And today we'll be presenting my SOAP note presentation on diabetes type 2. And so my patient here is patient PT, is a 65-year-old female with a date of birth of 5/10/1959. IHP is a primary medical insurance. And she presents to the clinic and is accompanied by her 18-year-old daughter. Her main chief complaint is that she's been having pain in her left foot. She also has been feeling extremely tired, more than usual. And she stated that she is diabetic and had stepped on a nail while cleaning her garage. So Miss PT presents to clinic once again with an open wound to her left bottom foot. Mrs. PT states to stepping on a nail during cleaning of her garage. The nail went through her sandal and punctured the bottom of her foot. The incident happened 3 days ago. The pain currently is 8 out of 10 and has been a constant, sharp, and pulsating pain described by the patient. She also states that it radiates to the top of her toes. Patient states that she feels some numbness on the top of her left foot, which started yesterday. So this is a new finding for her. She does take Tylenol 500 milligrams to alleviate pain, but currently has not been having any, it hasn't been helping her, in other words. The last Tylenol was taken an hour before clinical appointment. As far as her past medical history, she is diabetic, type 2, has been for about 10 years. She did have a cataract to the left eye and hypertension for 5 years. Preventative care, she says that all of her preventative care is up to date. Pap smear was done last year. Mammogram was also done 2 years ago. So that's, one that we're falling behind on. Immunizations, she did say that she's up to date except for the tetanus vaccine. Flu shot current, and pneumonia vaccine is also current. As far as surgeries, she did have a cholecystectomy back in 1999, hospitalization, 2 C-sections back in 1980 and 1982 with a tubal ligation. She is a gravida 2 para 2. She's currently in menopause and has been in menopause for about 15 years. No drug allergies. However, she is allergic to shrimp and pineapple, reports getting hives. As far as medications, currently she's on metformin 500 milligrams. She does take this 3 times a day. She takes lisinopril 10 milligrams by mouth for her hypertension, atorvastatin 20 milligrams by mouth daily as well for hyperlipidemia. As far as family history, mother is deceased, died at age 89 due to heart failure and diabetes. Father as well passed away at age 91 due to Alzheimer's complications. Maternal and paternal grandparents, unremarkable findings. However, older male sibling passed away from diabetes complications and renal disease. Remaining 2 male brothers alive, otherwise healthy, and remaining 2 sisters also alive with no medical conditions or concerns. Social history, sexually active, is married, obviously, a male partner. Currently in no contraceptives, as mentioned before. She did have a tubal ligation back in 1982, as in current, and is in menopause. As far as chemical history, denies usage of tobacco, vaping, drugs, or any type of illicit activities. She does enjoy going for walks with coworkers during her lunch break, participates in yoga, and attends church on Sundays. Both patient and husband are very active in their community. They own their own home, and they live with their 2 young small dogs. Part of the focus review assessment when discussed with patient, she denied any recent weight loss, denied decrease in appetite, fever, or any other concerns there. Cardiovascular, she did she did deny chest pain, palpitations, irregular heartbeats. Pulmonary, denied any cough, sputum production, wheezing. All the findings were in unremarkable. The GI system, denied any abdominal pain, heartburn, constipation, nausea, and vomiting. For the genitourinary, she did deny dysuria and frequency. Musculoskeletal, denied swelling to bilateral feet. However, she did have pain to the left foot, and she did express positive loss of sensation to the left, to the left portion of the top of her foot. Neurological findings: denied headaches, dizziness, insignificant there. Psychiatric: no mood swings, no depression. Endocrinology: denied intolerance to heat or increased urination, increased thirst. And lymphatic system: denied prolonged bleeding or bruising. Allergies, as we mentioned, just the shrimp, pineapple, she gets hives. Vital signs were also insignificant or unremarkable. Blood pressure was 135/78, heart rate 100, slightly elevated, could have been just anxiety. Temperature was normal, 98.0. Respiration is normal. Oxygenation, 98% room air. Pain, once again, 8 out of 10. Her BMI was 27.8. So on the obese side, PHQ was 8, which was good, which is normal. A1C was elevated in looking at her prior history and documentation. So we've got to work on her A1C. Once again, it was 11. As far as labs, we reviewed a CBC, A1C. We did a fasting AccuCheck in clinic, which was 159. EKG was normal. We did collect wound cultures, a UA for baseline purposes, and a stat x-ray, and we ordered a CT of her left foot. Stat x-ray, obviously, of her left foot as well. Physical findings: Miss PT was alert and oriented. Like I said, she is on the obese side, well developed, with noticeable facial grimacing, mild signs of distress due to the pain that she was experiencing on her left foot, but otherwise calm and not agitated. She was well groomed and supported by her daughter. Cardiovascular: normal sounds, S1 and S2, no heart murmurs, no significant findings there. Pulmonary, like I said, also normal. Lung sounds normal, no wheezing, no crackles. GI, active, normal bowel sounds in all quadrants, no distension noted. Genitourinary, no pelvic pain or tenderness when pelvic area palpated. Capillary refills for the musculoskeletal system were normal. Skin was warm to touch. No bilateral foot edema noted. She did have some mild tenderness on her left foot. As far as neurological, once again, patient was alert and oriented, time and place. No gait ataxia noted. No poor coordination. Everything was normal. No clonus as well. Psychiatric aspect of the assessment: appropriate mood and affect was noted. As far as endocrine, normal thyroid, no nodules or masses were palpated. And once again, lymphatic system: no bruising, swelling, or lymph nodes noted on assessment. And as far as allergies, immunological system: no hives or rashes noted either. So the 3 differential diagnosis was gangrene with an ICD-10 code of 196. The second, osteomyelitis with an ICD-10 code of M86.9. And the third was radiculopathy, which is M54.1, which was an ICD-10 code. And the gangrene, of course, it was something that we thought about, but we did rule that out. The fact that she was having pain and was sharp and throbbing, loss of sensation, called to possibly think it would be gangrene, given that it had happened for a few days and the patient was diabetic. However, upon examination, there was no necrotic tissue or edema noted. The second diagnosis, osteomyelitis, like I stated, that one patient does have history of diabetes, hypertension. She did have the trauma to her foot, which was a puncturing of her skin with the nail. However, osteomyelitis was ruled out on physical assessment. Patient did not display any type of arrhythmia, swelling, or excessive warmth to the affected site, despite reporting the tenderness. Fever and chills were also not reported by the patient. The third differential diagnosis, was the radiculopathy. Even though the patient did not have any spinal cord injury, the fact that she was having the tingling, the numbness, and the pain We thought maybe it could be something else other than that. So we thought it might be a radiculopathy. And for this patients that have this will usually express electrical shocks or some type of like shooting pain. In this case, like I said, patient did not have that. She did have some weakness, increased fatigue. But in our case study, the patient did not display any concerns as mentioned. Therefore, diagnosis was ruled out. And typically for this one, you rule it in if you have a straight leg test positive. And like I said, with her, we didn't have any musculoskeletal concerns. Treatment, of course, is managing the pain in patients that have this radiculopathy. So now I want to jump with, as far as due to time here, I want to jump into my primary diagnosis. Of course, she's type 2 diabetes mellitus with a foot injury, a foot ulcer, and diabetic neuropathy. She also is obese. So definitely for this patient, we want to do wound culture. I want to manage her pain by giving her Toradol 60 milligrams subcutaneous for pain in the clinic, clean the site, normal saline, sterile dressing to affected site. Want to provide her with her tetanus vaccine because she hasn't had that, and of course, given her injury now. We want to start her in a broad spectrum antibiotic while we pen for cultures. Definitely want to refer her to orthopedic, and then everything else that comes with her other diagnosis, referral to weight management, try to lose weight. We want to increase exercise by walking at least 30 minutes each day, if not at least 3 to 4 times a week. Limit protein, increase protein intake, limit greasy, fat, carbohydrated foods, increase green vegetables, things of that nature. Because of his history of hypertension, we also want to decrease sodium intake. Definitely referral to dietitian services. We want to teach this patient on proper footwear, foot care, trimming nails, and good hygiene. Apart from journaling, fasting and blood sugar diaries, we want to monitor that. We also want to monitor her blood pressure readings, and we definitely want to follow up with her in a week because we will be discontinuing her metformin and placing her on a basal insulin, which would be MPH 10 units in the morning. Given that this is a recent change, we want to monitor her closely to see how she's doing and adapting to the insulin regimen. Also, we want to do a referral for retinal screening and just be cognizant of foot exams every visit. This is my case presentation. I was rushing a bit through it, but hopefully you guys can benefit from this presentation. You have a wonderful evening. Bye-bye.